This is my patient chart. I'm gonna knock. I'm gonna walk in the door and perform hand hygiene. Hi, Sally. My name is Sarah Neal. I'll be a student nurse today. I'm gonna don gloves. Can you tell me your name, date of birth?
Sally Smith, 42501.
Okay, I can just see your wrist, please. All right, her wristband. I'm gonna check her wristband for her name, date of birth, and her medical record number. Thank you. I'm gonna match it with the chart. Match it with my knowledge. It matches. Do you have any allergies to latex, food, medications, tape, the environment?
No, not that I know of.
Okay, and that matches my chart. It says no known allergies, so we're right on track there. We're going to check her vitals, which I already have provided for me. Her blood pressure is 120/78. Her heart rate is 72. Her respiratory rate is 18. Her oxygen is 99%, and her temperature is 98.7 degrees Fahrenheit. These are all within normal limits. You feeling all right?
Yeah, I have some lower back pain.
All right. So when did the lower back pain start?
About like a month ago.
Okay. And where, like, in your back is it? You said lower back is like right or left, or?
Yeah, it's on like both sides, and it's like in my muscles.
Okay. Does it come and go, or is it like constant?
It's pretty constant.
Okay. And would you say it's like a dull, achy pain, sharp pain, throbbing?
Probably like a dull ache.
Okay. Is there anything that makes it worse?
Like moving around or lifting stuff.
Does anything make it better?
Laying on the floor.
Okay. Have you tried any treatments for it?
Just ibuprofen.
Okay. Has it been successful at all?
Not really.
Okay. And on a scale of 1 to 10, 0 being no pain, 10 being the worst pain of your life, what level would you say it is?
It's like a 5.
Okay. I'm sorry. I'll let the provider know about that. So can you tell me who you are again and where you are?
Yeah, I'm Sally Smith, and I'm at the hospital.
Okay. Tell me why you're here.
I'm here for my lower back pain.
And any important events coming up? Any holidays? Do you know the date?
Halloween's coming up in like a month.
Okay. So my patient knows where she is, who she is, like the general time frame. She's alert and oriented times 3. She doesn't appear in any acute distress, and she appears symmetrical in her body, equal bilaterally. And then she doesn't have any equipment, but if she had some equipment, I would double check. If she had nasal cannula, I would double check that there was no breakdown or lesions in the nares, around the ears or the face. If she had an oxygen mask, I would check for any kinks in the tubing, and I would check that she was receiving the proper oxygen flow rate per the provider's orders. If she had a catheter, I would check if that was properly inserted, that there was no skin breakdown at the site, that there were no kinks in the tubing, that was properly attached to her leg in the bed frame. And I would note the color, odor, consistency, the amount of the urine. And then if she had an IV, I would check for any redness, swelling, or irritation at the site, that there are no kinks in the tubing, and that she was receiving the proper solution and the proper dosage per the provider's orders, and make sure that she wasn't in any discomfort with any of this equipment. Right, I'm going to go ahead and perform the hands-on assessment. I'm going to check your hair. Her hair appears evenly distributed. There appears to be no rashes or flakes or lesions or anything. Her skin tone appears even, and it appears typical for her ethnicity. And I'm going to go ahead and check her temperature. Her temperature appears equal and bilaterally warm, and not necessarily cold at the extremities. And then I'm going to go ahead and assess her skin elasticity and turgor. So I'm going to just prepare your hand. Okay, her skin elasticity appears good. There's no tensing. And I'm going to go ahead and make sure she doesn't have any edema. There's no signs of edema. If there was, I would address if it was pinning or non-pinning. I'm going to go ahead and assess her capillary refills, so I can just borrow your finger. I'm going to depress each nail and one hand and one foot for 5 seconds and judge the refill. Capillary refill was under 3 seconds on both hands and feet, equal bilaterally. And then I'm going to go ahead and take a look at your ears. And there appears to be no redness or swelling or drainage, which is a good sign, the normal finding. And then I'm going to go ahead, if you can just look straight ahead at me. Okay, and then if you could just follow my pen light. Okay, her pupils are equal, round, reactive to light. The conjunctiva is pink and moist, and the sclera is white. And then I'm going to go ahead, if you could just lift your head up for me. Her nares appear pink and moist, and there is no drainage or swelling. And then if you could go ahead and open your mouth and say ah. Okay. And her mucosa is pink, moist, and there's no sign of any lesions or breakdown or anything. And the uvula rises to the midline, which is normal finding. And then if you could go ahead and smile for me. It's equal bilateral. Her facial expressions are proper to the situation, and there's no differences in facial features. And then also looking at her skin, I would have noticed that if there are any wounds or lesions, I would take note of any drainage or dressings that were apparent on that. All right. And then I'm going to go ahead. I'm going to ask you to sit up and turn around for me. I'm going to take a little listen to your lungs. And I've been assessing this entire time. She's been talking to me, and we've done the assessment, and there doesn't appear to be any labored breathing, any accessory usage of muscles when breathing, and her chest rises and falls equally and bilaterally, which are all normal findings. So I'm just going to have you inhale and exhale every time I move this on you, and I'll kind of guide you through. You go ahead and inhale for me. Exhale. Go ahead and inhale and 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 exhale for me. Still feeling all right? Not dizzy or anything? Okay. Go ahead and inhale and exhale for me. Go ahead and inhale and exhale for me. Go ahead and inhale and exhale for me. And go ahead and inhale and exhale for me. Her lungs sounded clear. There was no signs of crackles, wheezing, stridor, or rhonchi. If the patient had an incentive spirometer or it was appropriate for the situation, I would teach her how to use it and have her demonstrate the usage. Okay, so I'm going to have you turn back around for me, please. Just going to listen to your heart and just feel a couple of your pulses. So first, I'm just going to feel your pulse in your neck here. It's the carotid artery. They were equal bilateral. There was no sign of any thrills. And normally I would have had the patient. There you go. Normally I would have the patient not wearing a gown for this, for both the lungs and the heart, but in this scenario, I'm just she's wearing her sports bra. And then I'm gonna go ahead, if I could just see the inside of your wrists. I'm feeling for the radial pulse. Now I'm going to feel for the pedal pulse. The pulse rates are steady, equal bilateral, and they're a steady rhythm. And then normally I would feel for the point of maximum impulse, just would be her fifth intercostal space. And I would palpate and see if there were any lifts or heaves, which there are not. And then I'm going to go ahead and I'm going to listen to the carotid artery. I'm going to use my bell. I'm going to go ahead and have you inhale and then exhale and hold your breath for me. Okay. Okay. So I'm going to go ahead and have you do that again on this side. Okay. The sounds are it's a steady pulse. There's no sign of any bruise. Then I'm going to go ahead. I'm going to use my diaphragm. And I'm going to go ahead and listen to your heart. So just keep breathing as you normally would. All right. Then you go to the second intercostal space, right sternal border, and I'm going to listen to the aortic valve. Then I'm going to go directly across the second intercostal space, listen to the pulmonic valve, left sternal border. Then I'm going to go to the third intercostal space, left sternal border, Erb's point. And then I'm going to go to the fourth intercostal space, the tricuspid valve, left sternal border. And then I would go to the fifth intercostal space, mid-clavicular line, the mitral valve, and I would listen there. Everything sounded steady. There was no S1 and S2 were present. There was no S3 or S4 extra sounds. The rhythm was steady. And then I'm going to go ahead, and in that procedure, I would have had the patient lean a little more forwards if I had trouble hearing the heart at all. Okay. And then do you have any numbness, tingling, or swelling in any of your extremities?
No.
All right. And then could you go ahead and just grab my hands for me? Great, thank you. And then I'm just going to have you flex your foot and point your toes to the ceiling against my hand. Okay, you can just flex your foot and point your toes to the ceiling again. All right, and then if you could just step on the gas for me with this foot. All right, and then flex your foot that way with this foot. Okay. So her muscle strength would have been a 5. I also would have noted in her cardiac that her pulses were 2, which is a strong pulse, and then the 5 is the muscle strength, full range of motion, full resistance.